the venue family, a new concept was introduced: lung diagram, renal diagram, EFAS diagram. This way of documenting our findings is very helpful when we review the findings later on and in real time to mark for our fellow physicians what we thought that we see, what were the pathologies that we find. For example, here we have the renal diagram for hydronephrosis, and in a very intuitive way and easy way, we can mark what was the location that we were scanning and what were the findings. Here you can see for hydronephrosis, we had a picture of the right kidney with normal scan. Here the right kidney was scanned and documentation of our findings and real-time scans are presented here. Double click on that and we go into the renal scanning, and the diagram is here presented at the side. When we scan the lungs, we have very rapidly description of where we are. You can see the lung diagram here, and in any picture that we choose, when we review the study, we can know exactly where we scan right now, either Z1 zone, the anterior zones, or the dependent zones. As you can see here from the patient with a lot of B lines, I know exactly that we were scanning at the left lower area. The option and the ability for every scan, every day, to mark exactly where you found your pathologies is also very helpful, because later on, today, when the patient gets worse, or tomorrow, or 2 days forward, when you come back to the patient and scan the patient again, you know exactly where the pathologies have been. And now we can compare the current pathologies with 2 days before. And all that by comparing in easy way, side by side, the lung findings and the marks on the lung map where the pathologies were found.